Your vaginal pH is very important to your reproductive health. That is why I have put together this video to tell you the importance of the pH of your vagina. In this video, I am going to be telling you the normal vaginal pH and also the abnormal one. You will also learn the importance of having a normal pH level as someone who is trying to get pregnant and how your vaginal pH can protect you from having recurrent infection. You are also going to learn the difference between yeast infection and bacterial vaginosis, and towards the end of this video you will learn how to identify if the pH of your vagina is out of place and also when to see a doctor. You all are welcome back to my YouTube channel. I am the Wongo Nation president and I talk about everything fertility. Today we are going to be talking about the vagina. Some people are even shy of saying the word, but at the end of the day you will still go back to have sexual intercourse with somebody and see you need to be able to own what you have. Your vagina is very important and it constantly needs to stay healthy for you to also be happy. Look at the way I'm smiling. If I had issues with my vagina at the moment, I probably wouldn't be smiling like this because I might be itching on one part of it or another, or I could be having a very foul smell coming out from it that keeps me uncomfortable because I don't want other people to perceive what I am perceiving. And to you, the trying to conceive woman, your vagina is very important in your trying to conceive journey because the pH of it can form a very conducive environment for the sperm to survive and allow for pregnancy to take place. So let's get into it. Do you know the different parts of your reproductive system as a woman? If no is the answer, you are at the right place. The reproductive system is made up of different parts. The outer part is the one you can see, and that is called the vulva. After the vulva, you have the vagina. The vagina is the muscular part of your reproductive system, and that is where sexual intercourse takes place. After the vagina, you get the cervix and then the uterus, 2 fallopian tubes and 2 ovaries. Don't say you have not learnt anything from me, because right now you have just learnt the different parts of your reproductive system, and today we are looking at this very essential part, which is the vagina. The pH of your vagina is slightly acidic and the normal range is between 3.8 to 4.5. Why is it acidic? Why is it not neutral or alkaline? The reason is because your vagina contains a very good bacteria. This bacteria is called lactobacillus. It produces lactic acid. This bacteria produces this good acid that is harmful against bad bacteria. The normal pH range is not conducive for bad bacteria. This can prevent infection from happening, and to some levels it can reduce likelihood of you contacting certain sexually transmitted infections. I know you are excited at this point, so I want you to click that notification button and also subscribe to my channel because there is more from where this is coming from. Next, we are going to be looking at certain things that can disrupt the pH of your vagina. 1. Use of antibiotics. Yes, we need antibiotics. They are very necessary for treating infections, but sometimes the antibiotics will kill both the good bacteria and the bad bacteria, leaving you susceptible to infections. 2. Use of harsh feminine products. There is this unsatiable quest for us to smell a certain way, but I am here to tell you today that your vagina should smell like vagina and your vagina should taste like vagina. Does it actually have a particular taste? Because I don't know. You will see some ladies say things like, oh, my guy said that my vagina smells like perfume. If you are at that point where anybody is complimenting your vagina for smelling like rose flower perfume or any smell that is not vagina, then you have disrupted your vagina pH and now you are susceptible to infection. Your vagina is no longer protected as it should. Unprotected sex for a short while. After having unprotected sex, the vagina pH is going to change slightly. Now, this is just for a short period of time, and that is why certain conditions are noticed more on people when they start having sexual intercourse. Things like bacterial vaginosis, for instance, because having sexual intercourse can actually disrupt the pH. Another one is your menstrual blood. During your period, you're going to have your menstrual blood flowing out through your vagina, and this can also cause a disruption. Another thing that can disrupt your vagina pH is hormonal imbalance. This hormonal imbalance can happen at different stages of your life. For example, during pregnancy, there might be an increase in estrogen levels at that time, which can in fact disrupt your pH. Also, you can notice a change in pH when you are approaching menopause because of drastic reduction in estrogen levels. Another culprit is uncontrolled blood sugar, or people who are suffering from diabetes. When it is not controlled properly, it can increase the likelihood for the pH to be thrown off balance. Another one is your underwear. A lot of people don't pay attention to their underwear, but it can affect your pH. Non-breathable materials are not good for you to be wearing as undies. That is why breathable materials are always the best. How can you know that your pH is no longer within the normal? You can start noticing certain symptoms like change in smell of your discharge and the color as well. So if you're noticing grayish discharge or fishy odor coming from your vagina, you can also notice irritation or inflammation around your vagina. That can be a sign that your pH has been thrown off balance. Two major infections that can affect you when your pH is not within the normal. Number one is bacterial vaginosis, and the other one is vaginal yeast infection. These two things are not the same thing. Their occurrence is usually increased due to a disruption in your pH levels. Bacterial vaginosis as well as vaginal yeast infection are not sexually transmitted. That is why it is important for you to identify them and treat them. Whether you are having sexual intercourse with someone or you are not, you can have these two conditions. How can you tell the difference between bacterial vaginosis and vaginal yeast infection? Number one is what causes them. Bacterial vaginosis is caused by bacteria, while yeast infection is caused by fungi. Their signs are not the same thing. For yeast infection, you will usually notice thick white or creamy discharge that has a cottage cheese appearance, while for bacterial vaginosis, you will notice a discharge that is grayish in color and also has a fishy smell, more especially when you have sexual intercourse. Bacterial vaginosis will usually not come with a lot of irritation within your vagina, while yeast infection will come with things like irritation during urination as well as pain during sexual intercourse. The difference is their mode of treatment. They are not treated the same way. While bacterial vaginosis will respond to antibiotics treatment, yeast infection will not respond to that. You will be needing antifungi for the treatment. Yeast infection will not usually stop you from getting pregnant. But if you have bacterial vaginosis and leave it untreated, it can then go on to cause pelvic inflammatory disease. And pelvic inflammatory disease causes inflammation within your reproductive system, which can in turn lead to things like blockage of fallopian tube, adhesions within your uterus, or even around your ovaries. But treating both of them is really important to you for your own comfort. Do you see a doctor? Once you notice that there is a drastic change in the way your vagina is, the kind of discharge you are getting, whether you are being irritated, painful menstruation, painful sexual intercourse, then you must see a gynecologist immediately. They will help you to identify whether what you are going through is sexually transmitted infection, yeast infection, or bacterial vaginosis, and then they can make a treatment plan for you that will help you stay healthy. Remember, your vagina health is very important. I hope you've learned something good today from this particular video, and if you have, don't hesitate to share to a friend of yours. I'll see you all again in my next video, and before you go, click that like button, ask your questions in the comment section, and I'll be more than happy to take them. I'll see you guys again. Bye.